West. Republican Governor Bobby Jindal of Louisiana is a vocal critic of the president's health care plan. He joins us from Baton Rouge. Governor, good morning.
Good morning, Harry. Thank you for having me.
Read your piece in the Wall Street Journal yesterday. It sounds to me like your biggest beef with all of this is this government-run insurance plan. The president says it will increase competition. He said that last night, hopefully driving prices down in the insurance industry. What do you say?
Well, Harry, I liked a lot of what he had to say last night. I think his marketing is the best part of this. You listen to what the president actually said. He said he does not want to increase the deficit. He does not want government control of health care. He wants people to be able to keep their insurance. He says he wants to crack down on the abuse, the overutilization. All that's great. The problem is that's not what's in the House Democratic bill. The House Democratic bill increases the deficit by nearly $250 billion, increases taxes on employers. I don't know why we'd want to do that during one of the worst recessions in decades. But like you said, most fundamentally, it's creating this government-run health care plan. The Lewin study says that as many as 100 million Americans may leave for their private insurance for this government-run plan. This is the fundamental issue here. How do you have the government, which is paying for health care, regulating health care, now competing with the private sector? We've seen in Medicare, we've seen in Medicaid, the government underpays, tends to underpay providers, shifts costs to the private sector. They can have taxpayer subsidies. My concern, I think many people's concern, is they drive out the competition. And you have government bureaucrats deciding how much health care we can get.
How best then to insure the uninsured?
Well, I think there's several things that we can agree on. Absolutely, the status quo is not acceptable. We have to reform the insurance marketplace. Let's allow small businesses to form purchasing pools to drive down the cost of care. Let's provide refundable tax credits so the uninsured, the working poor can afford health care. Let's provide coordinated care, not fragmented care, so we do get the best disease management practices. Let's use electronic health care records like the president wants to do, but let's also put prices and outcomes on the internet so consumers can make informed choices. Let's also crack down on defensive medicine, frivolous lawsuits. One study says it costs $100 billion. Tort reform is
not part of this conversation, though, thus far. President insists that this will not increase the deficit. How do you best think this ought to be paid for? The only thing he sort of signed on to last night was taxing people who make a lot of money.
Well, and look, in the House plan, they're talking about an 8% tax on employers that don't want to participate, 2.5% tax on individuals that don't want to participate, surtaxes. The Heritage Foundation is saying our top tax rates in many states can be higher than what you see in Europe. We don't need to be increasing taxes during these economic times, but there are things we can do to make the healthcare system much more efficient. We all agree there's so much waste. Let's use integrated plans. Right now, 2/3 of the cost we spend go to people with chronic ailments like diabetes, asthma, and yet too many of those patients still end up getting fragmented care. They're still going to the emergency room for non-emergency care. They're not getting the treatments that would best result in better outcomes and drive down costs. The president's right. We can reform the current system. Nobody's defending the status quo, but we don't want the government, we don't want a bureaucrat telling us what treatments we can receive, which providers to go to, how much they'll be paid. You know, we don't want government competition in TV stations, in factories, in stores, in groceries. Why do we think we need government competition in healthcare? Why do we need the government to run a plan to make the marketplace work?
Governor Jindal, thank you very much for your time this morning.
Thank you, Harry.
All right, here's Maggie.
Thanks, Harry. David Axelrod is senior advisor to the president, and he joins us from the White House this morning. Mr. Axelrod, good morning.
Morning, Maggie. How are you?
I'm well, thanks. I'd like to get your response to Governor Jindal's remarks, saying that the president's speech was great, but it's all marketing. And what he would like to see and what everyone would like to see is not actually what is being discussed.
Well, the truth is that almost everything he said is subsumed in the president's approach to health care reform. He's embraced a lot of the same concepts, and that's heartening. The problem is that many of the members of his party in the Congress have not embraced a lot of those principles. And the bottom line here is, right now, health care premiums have doubled over the last decade. Out-of-pocket costs up by 1/3. Healthcare costs are growing 3 times the rate of wages. It's an unsustainable path, and the government is being crunched by it. Businesses are being crushed by it. We have to respond. Mr. Jindal says, well, the government shouldn't interfere in the market. The bottom line right now is that everyone is at the mercy of the insurance industry, and this would reform the system and put consumers in control, and that's what we need.
I would like to, we heard all that from the president last night, so if I may, I would like to change the subject and ask you about another comment that he made. The president said last night that he believes that Cambridge, Massachusetts police, quote, acted stupidly when they arrested Harvard University scholar Henry Louis Gates at his own home. The president wasn't there. Do you think he went too far in claiming the police acted stupidly?
I think what the president was saying is that when someone is arrested in their own home, after they've explained that they're in their own home, that raises concerns, and any American would feel the same way.
But he wasn't there, so was he right to assume that that's how it went down?
And Maggie, he acknowledged that at the top and said he wasn't there and he didn't know all the facts, and he was responding to the facts as they were reported. But really, he was speaking to a larger problem, which is disparities in the way people are treated sometimes, and it's a source of concern, and I don't think it's a new source of concern.
All right, I have 20 seconds, so I do want to give you the last word on health care. I heard the president say, quote, last night, "It's too dangerous to do nothing." And I remember him standing at that same podium using those exact same words when talking about the stimulus. How can he convince the American public, when we see unemployment still going up, when we see the housing markets not improving, that it really is too dangerous to do nothing? Won't people just think he's crying wolf?
Well, Maggie, since you were listening so intently when he spoke before, you also heard him say unemployment will be the last thing that will turn, but we have to get growth going. Again, economists agree that the recovery package probably has added 3 points of growth to the economy in this quarter, and it's brought relief to people who had lost their jobs, help to states that are in desperate straits, and tax cuts to 95% of the American people. So the recovery package has been effective to date, and there's more to come.
David Axelrod, thank you for taking the time this morning.
Okay, thanks for having me.
You're welcome.